Good morning, everyone. Welcome to the State of the County Address. This is our annual State of the County Address featuring our Supervisor Candace Andersen. We're thrilled to have you. I will admit it's a little unusual. We're usually doing this live at the Santa Rosa Marriott Hotel, and today we're in a studio, so it's a little different than usual, but we thank you for joining us today. Just a little housekeeping. We will have an opportunity to have question and answers at the end of Supervisor Andersen's presentation. And so there should be a little box on your screen that says questions and answers. So please, if you have a question you'd like to ask, please fill that out and we will try to do our best to answer every question that comes in, depending on the time. Now, just to let you know, we are lucky enough to have some gracious sponsors that make this event possible, as well as all of our other events throughout the course of the year. And I'd like to introduce our sponsors this year, and then they'll each have an opportunity to come on for a few minutes to tell you a little bit about what's going on in their individual organizations. First of all, we're thrilled to have this presentation done by Amos Productions, and Jody Amos is going to have a short video to start off our program. The next will be Mayor Bill Clarkson, the Mayor of San Ramon. We want to thank the City of San Ramon for giving us a sponsorship again this year. And again, this would not be possible without the sponsorships that we have. So thank you so much. After Mayor Clarkson, Bishop Ranch is also a sponsor. Unfortunately, Alexander Marin Jr. will not be able to present today. He's had a previous commitment, but we want to thank Bishop Ranch as well for their tremendous sponsorship. The next person that will be speaking will be Ann Lucina. She is the president and CEO of Santa Rosa Regional Medical Center, and then followed by Tom Garino from PG&E. So thank all of our sponsors so much. And the last sponsor, and not to be forgotten, of course, is Chevron Corporation. We appreciate their sponsorship as well as all the organizations that they sponsor throughout the Tri-Valley. And Juliet Don, at that point, will be introducing Supervisor Andersen. So thank you, welcome again, and we can't wait to hear the presentation. Thank you so much.
Hey Stu, thank you for the opportunity. As you mentioned, my name's Jody Amos with Amos Productions. We are an event production company and we specialize in audiovisual, staging, lighting, projection for corporate events and conferences. We also have an entertainment division with DJs, photo booths, and lighting for weddings and private parties. As you can imagine, we've had to reinvent ourselves since those events aren't happening anymore. So we have turned our warehouse into a live engagement live stream studio. We have a stage, all the conference aids, like a clicker for your PowerPoints. We have a teleprompter on our camera so you could read from, and all the studio lighting for you to give a beautiful presentation, as well as all the graphics and switchers and all that capability, which has been pretty cool. That's what we're using today for this stream here. So visit us at amospro.com and let us know if you'd like to host a live stream with us. Thank you. Appreciate it, Stu. Thank you.
It sounds like I'm up next. I would like to take this opportunity to really reach out and thank Supervisor Andersen in particular and her amazing partnership here with the city and with her staff. This is one example I would like to use is Candace went out and found a variety of park funds that had been parked in some funds and some accounts with the county that had been sort of forgotten. She brought these funds forward to us and allowed us to make some big improvements at Forest Home Farms and also along the Iron Horse Trail. And I really appreciate what she's done and her staff. I also want to thank Candace for being a part of our almost weekly Mayor's Breakfast. She has been there every week for us and has given us wonderful updates on what's going on with COVID, what are the new ground rules as they seem to change from week to week from both the state and the county. So thank you so much, Candace, and I look forward to your State of the County address.
Hi, everyone. My name is Ann Lucena. It's nice to see you all virtually. Thank you first to the Chamber of Commerce for having me, and also thank you to Supervisor Candace Andersen. I agree and echo Mayor Clarkson's comments. She's been a wonderful partner, as has the city and the mayor. I'm happy to report that San Ramon Regional Medical Center has had the lowest number of COVID positive patients of any hospital in the county. Our infection prevention measures are very stringent to protect our patients and our clinicians. It is very safe to get health care from your local physician or from our hospital. We even have an ambulatory surgery center where patients are able to get procedures done without stepping foot inside the hospital. I ask all members of the community to please take your healthcare needs seriously. Lately, vaccination rates and preventative care measures have dropped significantly, and as a result, cancers are going undetected and critical healthcare issues are being ignored. So if you have a serious health concern, please don't wait to address it. While 2020 has certainly brought its challenges, it's also brought a special milestone in our history, which is the 30th anniversary of the opening of our hospital. On this anniversary, in the midst of the public health crisis we're experiencing, we're especially honored to serve the San Ramon community with high quality patient-centered care. Just this week, the American Heart Association put us on their Stroke Elite Honor Roll list for our consistent quality in treating strokes. And the US News and World Reports recognize our high performance in colon cancer surgery. Bay Area Parent Magazine has repeatedly awarded our birthing center as being one of the best in the Bay Area. We're very proud of all of our services, from our heart surgery program to our orthopedics program that includes the first robotic spine surgery system in the Bay Area, and from our pediatricians who are in-house 24/7 to our emergency room, which has the lowest wait times in the whole county. In our 30 years, San Ramon Regional Medical Center has had more than 1.7 million outpatient visits, nearly 94,000 inpatient stays. We have delivered almost 13,000 babies. Our team is made up of over 600 physicians on our medical staff, 700 hospital employees, 170 volunteers, and about 20 wild turkeys that roam around on our campus. I really want to recognize all of their dedication and tremendous compassion of all of our team members, as well as the amazing community partners at the San Ramon Fire District, the EMS providers, the San Ramon Police Department, the City of San Ramon, the Chamber of Commerce, and certainly last but not least, the Contra Costa County. Thank you all for being a part of our history. Thank you for the tremendous community support you've provided to our hospital during the COVID-19 pandemic. We will continue to be here for all of you, and we look forward to the next 30 years. Thank you.
Hi, I'm Juliette Don with Chevron, and I'm the corporate affairs representative. And Chevron is pleased to sponsor the first virtual State of the County address with Supervisor Candace Andersen. And we're pleased to partner with organizations where we operate that strengthen communities. And we appreciate and value our partnership with the San Ramon Chamber of Commerce. And thanks to the hard work of Stuart Bambino and Kathy Fanning to make today's event happen, even though it has to be virtual. I have the honor of introducing Contra Costa County Supervisor Candace Andersen, who really needs no introduction, but to be fair, I will go through her bio, and many of us know her and appreciate her leadership. Supervisor Andersen joined the Contra Costa County Board of Supervisors in 2012. She ran unopposed and was reelected in 2016. She again ran unopposed and was reelected in 2020. Prior to serving on the Contra Costa County Board of Supervisors, Supervisor Andersen was on the Danville Town Council, including serving as mayor for 2 terms. Prior to being on the Danville Town Council, she also served on the Morgan Hill City Council, and she started her career as a prosecuting attorney in her hometown of Honolulu. She is a licensed attorney in both California and in Hawaii, and she and her husband, Philip, have 6 children. Now, her bio says that they have 6 grandchildren, but I understand that she actually might have another addition to the family. So I think that might need to be updated to be 7 grandchildren. In her role as Contra Costa County Supervisor, Candace Andersen serves on 24 local and regional boards and commissions that address pensions, economic development, healthcare, mental health, land use, and economic development and public safety. She also is involved in her community, and we can usually see her at a lot of events. Although certainly with the current pandemic, I've missed seeing her in person at a lot of events, but still have had the opportunity to see her virtually. Before I turn the mic over to Supervisor Andersen, I would like to take the opportunity to thank her for her leadership. We couldn't have a better board chair for the County Board of Supervisors at this point in time. And I appreciate how she's always accessible and willing to help, which has been really important during this pandemic. I'd also like to thank Gail Israel, who is on her chief of staff and also has been tremendously helpful as we navigate the pandemic and the various orders. So with that, I'd like to turn the mic over to Supervisor Andersen, and we look forward to hearing about the state of our county. Thank you.
Well, thank you so much, Juliet, for that very, very kind introduction. And to Ann and Bill, it's always great to see both of you as well, albeit virtually. And it's kind of fun to be out in person somewhere in a studio. And I've got to say, Amos Productions has a wonderful setup here for anyone wishing to do a virtual event. So today I'm going to run through what's going on in the county. A lot of you have heard me speak, as the mayor mentioned, at his morning breakfast, so to speak, but there is just always changing information. But let's start with COVID. And so these are the numbers from yesterday. Now, every day at about 11:30, these numbers will be updated. And so you can go to our coronavirus.cchealth.org to get the latest information. But as of yesterday, we had 89 new cases, which doesn't sound like a lot until you start looking at cumulatively where we are. 105 in the hospital with confirmed cases, and very sadly, we are up to 109 deaths in Contra Costa County. Now, what we look at is just not how many people are tested or how many people come out with this infection, because we know different people have different responses to it. Some people are asymptomatic. Some people have very, very serious consequences regardless of their age. But we do look at, of all the testing we're doing, we look at the percent positive. And anytime it's above 5%, we've been concerned. Just a month ago, we were down in the 3-4%. Now, as of yesterday, we were at 8.2% of everyone who tested positive. And what you see on that chart there is just the number of tests that are getting processed. And this information is not based upon the day the test is administered, but on the day in which we get the test results back. And we get that data from the state, it's reported to the state, and then we harvest that data back, and that's what we put on our dashboards. So this is a new chart that came out yesterday, and we've always had case counts by cities, but this new chart, although it's a little bit small, shows you what your 14-day has been. What were you 14 days ago? And I think it's a really helpful chart, particularly because we appear to be in another surge and an increase of cases. And in the last month, San Ramon has seen just under a 290% increase in cases, going from 58 to 168 cases. Right now, that puts San Ramon at 202 cases per 100,000. Again, that's kind of on the mid to low end for a lot of the cities in Contra Costa County, but nevertheless, it's something, a very solemn reminder. This is present in your community. We want to stop the spread, and we need to continue to take precautions. This hospitalization data shows you, just again, I gave you a little glimpse of it before, but you can see from this chart sort of where we've come. And so 105 in the hospital. In contrast, back in June, we were averaging 35, maybe 40 people in the hospital. So we have seen an almost tripling in the number of people who are hospitalized. And something that's critical to us is the ICU data. Now, just this week, we have taken off the NICU, which is the neonatal intensive care unit beds, off of our data. Originally, those were included. Needless to say, a NICU bed is not going to do a lot of good for a 65-year-old male. And so on this chart, and this is one that actually is not on the county's website, it's on the state's website, it shows you both positive patients, which is 108, but also suspected patients, suspected COVID patients, which brings us to an additional 39 patients. On top of that, we have learned that we have about 15 at any given time patients who are Contra Costa residents who are actually in Alameda County hospitals. In large part, west end of the county, those people who might be at Kaiser Richmond, might need hospitalization, will end up in Oakland at hospitals there. It also shows us how many people are in the ICU. And unfortunately, it's not just COVID patients in the ICU. In fact, we've come a long way from the first outbreaks of COVID in how we treat patients. So currently in Contra Costa County, on this chart, you can see we have 35 patients who are definitely COVID positive in an ICU bed, an additional 4 people who are suspected to have COVID who are in those beds as well. That leaves us right now with 44 available beds. And that makes it a little disconcerting because, again, the ICU number is just based on all available beds. Of course, there are other stroke victims, heart victim or patients who are in there who also are taking up those ICU beds. When we get below 20% available beds, that's where we're feeling great consternation, and the state looks at that as one of those indicators that's very serious. And so who's getting sick? And this is interesting data, and certainly by race, we look at this. The hard part is we continue to still have a large unknown bar at the bottom. And that is because when we're doing testing, as people fill out the paperwork, they may decline to state their ethnicity. We may not know. But when you look at the chart on the right, on the lower side, you see that the green bar shows you the percent of population, for example, of our Hispanic Latino population, or Latinx is more commonly used right now. And then the confirmed cases is the blue bar. So as you can see, in our Latinx population, we are seeing a disproportionate number of cases. And it's something we're working on as a county, both with our outreach being bilingual, as it has been from day one, but also increasing our testing centers in those communities where there is a higher population. And the sad reality is that for just the way our economy is right now, many individuals do not have the luxury of working from home like so many of us do. And so they are some of these frontline workers who are exposed more. Oftentimes we may find multifamily living in a single household where the transmission rate is a little increased. But we are continuing to work on those because we know that is so critical if we have one segment of our community that is disproportionately coming down with this virus. So let's look also at age groups. Now, if you look back in June, we were seeing a lot more people who were a little bit older getting it. And initially there was a lot of thought of younger people don't even get this virus. They don't have to worry. And sadly, that is not the case. And post-Memorial Day, you can now see in the bottom right-hand side that it is the 19 to 30-year-olds that are coming down with COVID most rapidly. Now, admittedly, studies are showing most 19 to 30-year-olds do not have extreme reactions to it, but some do. None of us have immunity to this virus, and we have seen countless cases of people in this age group throughout the country, throughout the world, having very, very serious consequences. And of course, it's not just them that get it. They can easily spread it to their parents, to their grandparents, people who may be more vulnerable. And so we look at who's dying in our county. And this is a breakdown by race, and all of this information is on that coronavirus.cc Health website that I provided you at the beginning. And as you can see, with our deaths by ethnicity, the Hispanic Latino is not as high as it could be given the high case rate. We do see predominantly it has been Caucasian individuals who have passed away. Similarly, when you look at the percentage of Black African American in our community, that number is lower than the population of African Americans percentage in our community. But the age is a big issue, and I think all of us have looked at this, and these are charts where I then have broken down. So again, you're seeing most people who are dying are between the ages of 81 and 90, older than 70 years old. But as you can also see, people in my age group are passing away, the 61 to 70-year-old. Many of you may relate to that age group, even the 51 to 60-year-old. It's a virus that doesn't just prey upon one segment demographic of the population, but we are seeing still a large percentage, even the largest percentage, of being older individuals. And so I have the chart on the left, is the upper left is what our numbers looked like in June. And then you can see how it's fairly similar, other than we've seen a little bit larger increase in the 81 to 90-year-old group in these last few weeks. And so we just finally, and this is something we've been requesting, when I say we, the Board of Supervisors, we've wanted to provide to the community information about where are the deaths, what communities are they in. And because of privacy rights, because so few deaths have taken place, there were some ethical concerns and privacy concerns, HIPAA concerns about releasing this data. We finally got to a point where, after jumping through a few hoops, we were able to get this out there. And so, as you can see, San Ramon currently does not show any deaths, and I'm aware that there may have been deaths within San Ramon Regional Hospital, or at least one that I'm aware of. However, I think the individual there was a resident of another country, and that's why it would not necessarily reflect in San Ramon's numbers. And so the location is the residence of the individual. Danville has seen one death, and Alamo has not seen any, as has San Ramon not. Much of the death we are seeing is connected to long-term care facilities, and this has been a nationwide problem. It's one that we have known from day one when we first started getting these outbreaks. And 2 weeks ago, we started breaking down the data in our community to show that sort of the beigeish green color shows you those deaths associated with a long-term care facility. The blue indicate just someone in the communities passing away. And so it's important to note that it's not just people in long-term care facilities. Right now, it's about 70% of our deaths have been associated with long-term care facilities, but the rest aren't. They're just out in the community. And more importantly, most of the cases are not in long-term care facilities. Most of the cases are within the community. Right now, our long-term care facilities make up less than 7% of the cases throughout the community. And I'll talk about it in a moment, just what we are doing to really look at how do we help these long-term care facilities. They are regulated by the state, not by the county, but as soon as we have a confirmed case, a confirmed outbreak, we continue to work with them, and some of our partners do. And it could be San Ramon Regional, it could be John Muir, it could be Sutter, it could be Stanford, it could be Kaiser. All of our healthcare partners, many of them already have relationships with these long-term care facilities, skilled nursing facilities where they send their patients. And so we work really hard with them to have conditions in place to protect these individuals. Since early in, I believe it was in April, we did a health order that's when we prohibited visitors in these long-term care facilities as a way to try to prevent the spread of the disease, because we knew so early on how vulnerable this population was. And so this shows you your total cases. We've had 541 that are connected with either patients or the providers of services within the long-term care facilities. We've had 78 hospitalizations, and that's a cumulative number. That doesn't include, it's not a rolling number. It doesn't mean that 78 of the 100+ individuals in hospitals now are from long-term care facilities. In most cases, because there's a higher level of medical care there, there's no need to transfer the patient. And then we keep on our dashboard that I invite you to go to. We have a dashboard specific for long-term care facilities, and this shows you how many outbreaks, active outbreaks we have. And so currently in our county, there are 22 active outbreaks that we are working with, coming in to increase, and I'll go through the list of what we do. And then we've resolved 11 different outbreaks, and the graph down below shows you just the trajectory that we've gone with our long-term care facilities. And so when there's an outbreak, county health immediately comes in, or one of our partners, they send in a strike team to review first the infection control practices to really nip the spread of it in the bud. A mobile testing unit goes in and and patients are tested, all staff is tested, and then we do routine testing even before an outbreak. We want to identify it because, again, we recognize that sometimes people are asymptomatic. They may not be exhibiting symptoms while they in fact are infectious. And then county health and partners, this is the surveillance testing that I'm talking about, where they are going in and doing that. But it continues to be a significant concern. As I point out to people who say, well, why should we worry? You know, it's just 70% of the deaths are in these skilled nursing, long-term care facilities. I point out that it's not spontaneously combusting in those facilities. Somehow the virus is coming into those facilities, it's being passed on to those individuals, and we need to continue to work very, very vigilantly to stop the spread. So other type of a congregate care facility that we're very concerned about from early on is our homeless shelters. And so our initial reaction was to stop taking in new people to our homeless shelters, and through the Project Room Key, which is a state program partially federally funded as well, we were able to rent hotel rooms. And so, and these aren't fancy hotels, these are the Motel 6 in Pittsburgh is one. We have them throughout the county. And so currently we do have 568 homeless individuals who are currently housed in hotel rooms. We have not had any deaths in our homeless shelters, in our homeless encampments, and we are showing on our homeless dashboard by graph how many people are housed on a given day. And then we've also, at the request of various cities, set up sanitation stations with hand washing, with bathrooms, so that at our encampments, which are kind of like a household where we hope that the spread of anything will stay within, there will be improved sanitation practices. We also have our core teams, our community outreach teams that regularly work with the homeless, who are out there taking temperatures, trying to help with any infection control, housing people, and even if someone needs a place to go because they have the infection, even if they're not homeless. Say it's a multi-generational household and someone comes down with it, we do have hotel rooms and places for them available to go where they can quarantine after being infected. Other place, and little flashing screen there, and I don't know, hopefully it's not flashing for the rest of you, it's flashing for me, is in our county jails. And we have not had any outbreaks in our county jail, and we have identified, though, through our practices and procedures, 13 different cases identified. And the procedures have been since March. One, let out as many people in the jail as we possibly can, simply because we do not want the infection spread. So low-level offenders, and I'll talk about those in a moment. But we did have a practice where if someone is admitted to the jail for 14 days, they are put in a quarantine. And so during that quarantine period, they are required to not have contact with other inmates, and they are tested. And through that period, we were able to identify 13 different individuals who did in fact have an outbreak. And I'm going to jump ahead. I think we had a little bit of I'm going to pop forward to my slides here, and we always have technical difficulties, but that's great. Technology is a wonderful thing, and I'm glad I can be doing this presentation. And so currently we do not have any inmates who are COVID positive in our jail, and we have identified at 4 different deputies. 2 of them have been able to return to work after, but no outbreaks. And that to me is a significant achievement given what we've been dealing with in other parts of the county, other parts of the state. And I have just lost my PowerPoint feed. And so I'm going to jump, here we go again. We're going to pop forward, and I'm going to talk a little bit about, right after jails, I was going to talk to you just about who is staying in our jails. And so we did reduce the jail population. Through this, you can see we primarily had some very serious offenders that remained in the jail. There is still a call from many, release the prisoners, but you have to balance public safety. And currently, San Quentin had a significant outbreak. We do not have any of those San Quentin prisoners in our hospitals. They're primarily being housed in Marin County, San Francisco. And right now, hopefully the state has that under control. Some of the San Quentin prisoners who have been released with an early release, with an early parole, we are working to ensure that they are appropriately tested if they're released to our community and that they have appropriate housing. So we've got state orders, county orders, and this is where the confusion so often lies, because state orders come down and then the counties, and ultimately it sort of comes down to who has the most restrictive ordinance or order rather, and that's the one that will generally apply. So people often ask me, who is this Dr. Farnatano that is issuing these orders? He was appointed our health director back in July of 2018. Bright man, went to Duke University for medical school. He's both a family physician and HIV specialist, which has been very helpful with this extremely infectious disease we're dealing with. And he's been with the county since 1991. And originally, early on, I think you all were aware, the health officers in the entire Bay Area were working very much in concert together to have consistent orders. Ours were even stricter than what the state was going to offer up, but they felt it was in the best interest of the community. And when we did our first shelter-in-place order back in March, and we knew the extreme impact of it, we were very concerned because we knew if it was successful, people would then say, why did you even make us do it? It wasn't such a big deal anyway. As we've loosened things up and we're seeing that impact, you can see what wisdom there was early on, and the modeling we use, which is a Stanford model, shows that we would have had several thousand deaths in Contra Costa County had we not done that initial shelter in place. And so the health officer's order is something that he has authority to do this by there are two different California Health and Safety Code sections that give him the authority in an emergency and when there is a pandemic, a virus of this type, to go ahead and make the orders as are needed. Now, the county health officer also relies upon certain indicators, and really these are the indicators as to when should we start to loosen things up a little? When should things start opening up? And so he looks first at, the total number of cases, total number of hospitalized patients. Is it flat or decreasing? Unfortunately, right now it's not. We're seeing those increasing. We look then at the sufficient hospital capacity to meet the needs of the residents in the community. And are we doing sufficient viral detection tests conducted each day? Now, right now, and I'll talk a little bit more about testing in a moment, we are doing sufficient testing. The problem is we're not getting our test results back soon enough. And for any of you who have had a test in the last 3 weeks, you might have waited a while for your test. Our county hospital or county health is able to turn around tests within 72 hours. As we contract with San Francisco, we're able to get it in 48 hours, but a lot of our commercial providers are taking anywhere from 10 to 14 days. And so we are feverishly, no pun intended, working on really trying to find alternate ways to test. There's the batch testing method that many of you may have read about, where you could get 10 to 20 samples, test them in a batch. If it comes out negative, all of those people are negative. If it comes back positive, you would then individually test each of those samples to identify who in fact is infected. You have to have FDA approval of your equipment if you want to use batch testing, and we're seeking that for our county health operated labs, but we certainly are working with our commercial labs and other commercial labs to develop new contracts, because none of this is going to be effective unless we can do the contact tracing. And then the other thing we look at is having at least a 30-day supply of personal protective equipment. For the most part, our regional hospitals within Contra Costa are able to attest to that. And so when things were going well, back in May, early June, we did apply for a variance to move a little bit quicker through the state's timeline. We were given that variance, and that's when we opened up indoor retail, outdoor dining, and then we created a wonderful timeline. We had this whole roadmap, and all of us were so excited to move forward on this with these things that were going to be open. And right before July 1st, actually it was June 29th, my 60th birthday, I got a call from Dr. Farnatano saying, our case positives up to 8%. We've got to slow things down. And that was a really sad moment for me, because I was hopeful, like so many of you, that if we had just sheltered in place for those few months and we were just going to slowly open the economy, we'd be okay. Now, what we're showing is that most transmission isn't coming from going inside a retail establishment or even outdoor dining if people are following appropriate precautions. It's coming from gatherings, from graduation parties, Father's Day parties, weddings, celebrations where people are extending beyond their 12-person social bubble that we've been encouraging for the last few months. And so, again, be careful. We hope to continue to corral this in. And then we did have, of course, the governor stepping in 2 weeks ago, and he ordered certain things shut down if any county was on the state monitoring list. And so for us, we had just opened up hair salons, barbershops, indoor malls, indoor places of worship, or indoor protests. Those had to be discontinued. Things that we had hoped to open on July 15th, which included indoor restaurants and bars and movie theaters, zoos, museums, fitness centers, offices for non-critical businesses, personal care services like nail salons, those also had to be delayed. And so we don't have a timeline right now when we will open those. We will have to get off the state's monitoring list. But this is on our website, sort of an openings at a glance. I'm sure it's very small on most of your screens. You can go to the website and see what is open, what is allowed right now. These are the indicators used by the state to determine if a county should be on the watch monitoring list. And so the state has these guidelines set forth, and one is elevated disease transmission. And so they base it on a greater than 100 cases per 100,000 over an average of 7 days. And right now, for our average over 7 days, we're at 130.2, which puts us over that 100. So that's one of the primary reasons we're still on the watch list. They also do not want to see our test positivity being above 8%. We were just below 8% last week. We are back up to 8.2% as of yesterday. Increasing hospitalization, the state looks at that as well. And so they look at a percent change for a 3-day average to see if we've increased over 10%. We jumped really, really fast. But for the last couple of weeks, we have been we haven't exceeded 10%, even though our case numbers are in 100, to 109 at any given time. And then we look at the hospital capacity. And this, of course, is we don't want to have the scenes that we saw in New York or in Italy where there are preventable deaths, where people who need hospitalization are not able to get it. We've seen that even taking place in other parts of California, down in Southern California, Imperial County, where they have had to send patients as far north as us, and we have had up to 4 patients from Southern California because they reached that capacity. And so right now, what they look at from the state standpoint is whether or not you have less than 20% of your hospital ICU beds available. And as of yesterday, 26% of our hospital beds were available. So we don't have a lot of margin room. We're in that danger area. And then ventilators. They want to make sure that you don't have less than 25% available. And fortunately, because of the changes in treatment, the benefit of certain medications like remdesivir, and I'm going to say it wrong, a very common asthma drug, we'll call it that, we don't have to put everyone on a ventilator, and that's a good thing. So right now we have 43 of our 239 ventilators available in Contra Costa County. Now, we still are offering free testing for individuals, but our priorities are given to first responders, given to healthcare workers, to those who are part of a household where they may have been exposed. And so because we are seeing the slow turnaround time, which in large part is because we don't always have the testing supplies we need. And so it's been a challenge because one day we might have a reagent we need, the next day we won't, but we still do at all of our test sites, including at Bishop Ranch, and I want to thank Bishop Ranch for hosting a county test site. You can go in, you have to have an appointment by either phone or you can do it over the internet. Make an appointment. They will ask you if there's a priority reason why you would get an immediate test, and they will have the turnaround time based on that of which lab they send it to. So if you're feeling any symptoms, definitely get tested. If you just want to you've been exposed to someone, you've been on an airplane, you've been somewhere and you worry about it, you certainly can be tested, and we want to encourage people to still get tested, recognizing that we are prioritizing certain individuals. So we did, on Tuesday, pass administrative fines for violating the health order. And this was controversial. And it was something where I honestly do not believe any of our cities, and especially the city of San Ramon, are planning to drive up and down the streets, look for mask violators, and issue a ticket. I just don't see that happening. The reason we did go ahead and move forward with it is under the health order, it was a criminal prosecution if someone was violating the health order. So if a business chose to remain open or have a restaurant, instead of doing outdoor dining, decided I'm going to do indoor dining, we would have to prosecute them as a misdemeanor through a jury trial, and it's a very onerous process. And so we followed suit of several other communities, which is you set up an administrative fine. And it's much like a parking ticket. You can have a hearing officer hear it if you don't believe it was appropriately issued to you. And so for non-commercial fines, which would be individuals, the first violation would be $100, then $200, then $500. But we know that our police departments really want things to be educational. And so there is the ability to first just have a notice of violation. And again, our focus, it really is going to be complaint driven, and just if someone's not willing to comply with the appropriate authority, asking them to. For a business, we do have a little bit higher fines, and so the first violation would be $250, then it could go to $500, and it could go up to $1,000 for each additional fine. And so again, it will be up to each jurisdiction to determine how they want to enforce this, and we'll see how that goes. But again, I think hopefully you're all out there wearing your masks, or you have it with you, so that when you're within 6 feet of someone, you're going to pop your mask on. And I think it's something important that was noted this week. For months, they continue to tell us masks are to protect those around you. It's to prevent your droplets from spilling upon other people. And this week's studies are finally acknowledging there's some benefit to you also. If you have a mask, you're less likely to inhale those droplets. You're being a little bit more careful because of that. So contact tracing, as I mentioned, contact tracing is a critical component. It's where you find out who someone who is very, very sick has exposed others. Who, if someone's not very sick, how they've exposed others. And so currently we are going to be up to next week to 181 trackers. That's 5 times the number of trackers we had pre-COVID. We've always had some contact tracers, only because there's communicable diseases, such as measles, chickenpox, mumps, things where people still come down with them, and we need to make sure they haven't exposed the general population. Currently, we are able to track 67% of the cases, which isn't great. But when you have tests that don't come back to you, 12, 14 days later, it's really, really ineffective. And I will say, for our health officer, his number one priority is getting the test turned around so that we can have effective tracking. And when you look at other countries in the world that have successfully dealt with this, it has been that quick ability to identify who is sick, track their contacts, and that keeps the community safe. So we do have, for those of you who continue to have questions, which you should, because our health orders are changing, every Thursday at 1:30 p.m. we have what's called a COVID ad hoc meeting. And the agenda is posted on the county's website under Board of Supervisor agendas, and Supervisor Mitchoff and I run that meeting. And it's an opportunity for people in the community to ask questions of our health officers. And so we take questions in advance, and then we have a public comment period, and the health officer responds to the questions. And it's just one more way for businesses, for individuals to get answers to their questions. So school in the fall, that has been a big, big issue. And for so many of us, all of us, I think, just wish that we could just open up the school doors and have our children going back in. Unfortunately, because we continue to be on the watch list in Contra Costa County, we would not be able to start in-person school until the county is off that list for at least 14 days. Now, the state is allowing for waivers for elementary schools. However, you have to, apply to the county, and then the county, in conferring with the state, has to agree to this waiver. We are waiting from the state to give us the guidelines for what criterion do we need to rely upon as a county to grant those waivers. The big caution right now is, we were just discussing it with Dr. Chris Varnatano, is our testing. We need to have that rapid testing available, because if in a cohort of students someone breaks out, we need to be able to test and track immediately so we don't have to continue to just automatically shut down a school. So we will see. So far, our county health has received a handful of requests, but as I mentioned, we're still waiting for further guidance from the state as to what that needs to look like. So continue to talking about, everyone, we talk a lot about social distance, but I want us to start calling it physical distancing. We want you to have those social interactions, but do them virtually. Do them from 12 feet away. Do them from 10 feet away. We need those connections, and it's just very, very challenging if we don't. So continue to physical distance, cover your face, keep washing your hands, carry that hand sanitizer with you wherever you go, and most importantly, stay home when you're sick. Many of us always have sort of fought through that cold or fought through that bug that we have, but when you're sick, we need you to stay home. So other issues that I'm going to touch briefly upon for the county: census. And I've got to thank Aparna Madi-Reddy, the San Ramon resident, who has been on my census team for Contra Costa and has done some great work in your community to raise awareness about the census. And this happens, every 10 years. It's critical for the money we get back. And in our county, where we have just under a $4 billion budget, we estimate that it's about 10,000, it's about 2,000 a year for each citizen who we don't count, that we lose in federal revenue. And so for us, it's important to have that. It also really shapes our communities. And as San Ramon has shifted to district voting, as we have Board of Supervisor districts, and you, of course, have Assembly and Senate and congressional districts, census helps determine those because it's based on population. We're doing pretty well in Contra Costa County. National response to the census has been around 62%. California has been just over 63%. In Contra Costa, we're at 71.2%. We are the second highest county in responding to the census. So if you have not filled out your census form, just go online, and it's very, very easy to do. It just takes a few minutes. Black Lives Matter. This has been something that has been important to the entire Board of Supervisors, and we have a lot of programs and procedures already in place well before this most recent resurgence of this discussion, and it's a very important discussion, but they include a racial justice oversight body that really looks at the disproportionate representation of people of color in our criminal justice system. We've been working on this for the last 5 years. We've got recommendations of ways to approach it. We have a racial equity action plan. We have a juvenile justice coordinating council that really looks at why do we have so many youth of color disproportionately engaged in the system compared to Caucasian youth? What are we doing with our diversion programs in some parts of the county? How can we increase those? We have a hiring outreach committee in Contra Costa that looks at every department to see what both our gender and our racial composition compares to the county's composition. And if there's a lacking, if for example, there's a disproportionate number or a lack of, say, white women working in public works, they will do outreach to white women. If there's a lack of, compared to the county population, of Hispanic males in a certain department, they will come up with a plan for more outreach into that community to ensure that we have a very racially diverse county employee population that reflects what the population as a whole is. And we've got a hiring we have an Economic Opportunity Council that's very helpful. I will point out that our Sheriff's Department does not receive any military-grade weapons or vehicles. And we have been in the San Ramon Valley. We've had some great discussions that the mayor's been a part of, along with Discovery Counseling Center. We have a lot of de-escalation that we've been working on in the county, which includes mental health evaluation teams that go out with our police officers in a crisis situation, as well as a mobile crisis response team. And we encourage people to call 211 when there is a crisis. If it doesn't need police, there can be intervention that way. And we have, with our sheriff deputies, they have a 32-hour now crisis intervention team training that will help them be better prepared. And this training is also available to our local police departments. And we do a lot of implicit bias training because we recognize all of us have implicit bias in different ways. And so from the Black Lives Matter movement, it's very important to us. On Tuesday, we had a Truth Act forum, which we do each year to disclose any contact the Sheriff's Department has had with ICE. The contact is fairly limited, with them requesting to be let known when certain individuals with very serious crimes are released. There are some in the community who don't think we should reveal this information, others that think we do, and I think the sheriff is finding a very appropriate balance. Big push, defund the sheriff. Last week, I had a protest at my home with individuals who think we should defund the sheriff, but the majority of us on the Board of Supervisors recognize that to achieve the objective of addressing racism, to create better community policing, you don't necessarily have to defund the sheriff. Now, you will see as we look at our budget coming forward, we will have some shifts in the sheriff's budget. We will see some more funding that's going to be going to health, mental health within our jails, which is a little bit different than we previously have done, but there is not a big push by most of us on the board to defund the sheriff, despite our desire to reach these strong objectives of ensuring that we do have racial equity in our community. So here's our budget. It's just under $4 billion, and we do start our budget hearings next week. Revenue source, largest one, it comes from our hospital health plan. We do have a county hospital. We have county health clinics, and they're very expensive to run, but we also do receive revenue both from federal and state dollars as well as fees for services. Then we have intergovernmental rental revenue, which is a lot of the social safety net programs that we provide, the food stamps, the CalFresh program, our women and children programs, our workforce development, things of this nature that really help families. And we, of course, are seeing with the crisis we're in right now, many, many more families in need. And so we've really increased our staff to process applications for those who need to receive CalFresh. And so we're continue to really work on those things. We will see probably about right now about a $32 to $34 million cut in our budget. We have expended so far, responding to the COVID crisis, about $85 million to date. We are getting back some CARES Act funding, or we have already received it, that helps offset many of those expenses and the expenses we anticipate through the end of the year. And so when you look at our budget, you can see that, again, this sort of goes to the concept of defend the sheriff. Currently, we spend just under 70% of our budget does go to helping health and human services, law and justice, which is the sheriff, the district attorney, the public defender, and our jails, makes up just slightly over 14% of our budget. And then we have general government, which is 16%. Big discussion right now is whether we should keep open the Orrin Allen Rehabilitation Facility, which is also known as the Ranch. It's a juvenile facility out in Byron. Currently, we have fewer than 15 boys housed there. It's about $13 million in repairs, and we're looking for a lot of alternatives to incarceration. We do also have a detention facility for youth in Martinez. And with our new chief probation officer that we just hired this year, she also really embraces the concept of keeping youth out of jails. She'd much prefer to see them receiving programs in the community. So I think we'll see that declining as well. As for San Ramon, we've got this funny tax share agreement that the mayor loves to talk about, and I do too. And so with Bishop Ranch, and so we're in discussions right now if City Walk moves forward about, because it is so residential, whether we will readjust as we have previously our tax share agreement to acknowledge that these are, in fact, residential units, and they probably need to have a little bit more of the tax increment. And right now, we are doing our own general plan update in Vision 2040. And so I encourage you, if you're interested in the county's general plan, because we do have a lot of unincorporated land that borders you, to look at that. It's something that, particularly the Tassajara Valley, I don't see a lot changing out there right now. And there is one project that is pending. It has not come before our planning commission yet, and that's the Tassajara Parks project. We don't have a date yet for that hearing. And then the latest thing is countywide sales tax. It looks like you will have the opportunity to vote on that in November. And I was the one no vote. I do not think in the middle of a pandemic, when so many families are reeling because of the impact, the economic impact of this virus, that we should be putting another half-cent sales tax burden upon families. It is one of the most regressive forms of taxation. And while I did support a transportation sales tax last year, we were in a very, very different time. Our unemployment at that time was below 3%, and today our unemployment is over 13%, and we're in a very different era. So when people ask me, well, you supported a sales tax before, why not now? I just say we are in extremely, extremely extraordinary different times. And so finally, my office is still there. I keep it staffed during this crisis, although most of my staff is working remotely. We are there to help you, and if you are not receiving my weekly COVID updates, please email us. We would love to add you. We send you the latest information we have each Friday afternoon. So, end of my presentation. I think I've got some questions. Well, or I see one question up there, and maybe that's the only. This is your opportunity if you're watching. If you have any hardball questions for me, type them into the chat, because I do have a very a nice comment from an anonymous attendee who says that they appreciate everything we've done for the community. I'm disappointed to see people resisting measures and getting personal with health officials. Anything to support Dr. Farnatano. He has to deal with people attacking him and even showing up at his home to protest health orders. Yeah, we have had to increase security for Dr. Farnatano. The reality is, I get that this is such a hard time for so many people, and there's passion in people's beliefs about whether or not there is a serious health threat or not. I personally believe we do have a very serious health threat, and I would just encourage you, again, even if you're uncomfortable with health orders, please, for the sake of everyone else, follow them. It's the only way we're going to get back to moving forward to reopening all of our businesses is if we can stop the spread of the virus. And the only true way to stop that virus is to stop being around people when we are contagious. And the best way, I'm going to encourage you, I have my variety, you've got my Hawaiian mask that I often wear. You put on a mask, you don't create social gatherings that are beyond your social bubble, and your social bubble should be people that sort of have the same tolerance for infection than you do, that you know they've been as safe as you have, and try to keep it to one social bubble, not multiple social bubbles. And just, again, practice that precaution. It may seem silly to wash your hands for 20 seconds, or it might seem silly to stay home if you just have a headache or just a little scratchy throat. Do it anyway, because that's how we're going to save lives.
Candace, we have another question from
Okay.
Jen Juroff.
Okay.
Let's see. Oh, my question I was going to read just went away. What specifically are we doing to increase testing turnaround time?
Great question. And so we are going out and creating new contracts beyond the ones we already have with additional labs. We have many medical providers that we already contract with for some services. Maybe it's radiation services or something else, but they have lab capacity. We are working with them. We are purchasing more equipment for our county labs. And then, as I mentioned before, that concept of batching, where you're able to test 20 tests at once, or 10, could be 10 to 20, depending upon the capacity. It might be as few as 12, but nevertheless, where you're doing large batching so we can turn around. It's something that Dr. Farnatano has indicated is his number one priority. The challenge is it's not just us in Contra Costa County that are not having this quick turnaround time. It's a problem throughout the country, and so labs are being inundated with testing, and so that's why we have to create new testing. Maybe it's going to be veterinary labs, maybe it's going to be college campus labs, but we do have a logistics team that is actively looking for additional lab capacity to process these tests, because we can't move forward without it.
A follow-up question. When will we see the impacts of these increases?
Of these increases? Well, the way increases in cases, I think, I'm assuming you're saying, typically what we've been seeing is when we see a surge in case count, Then we see the hospitalization. We've seen the hospitalization go up. And then typically people have been hospitalized 2 or 3 weeks, and then oftentimes they pass away if they're in the hospital. So I think we're going to probably, just based upon the surge in hospitalizations we've seen, we should see our death rate continuing to go up. My big concern is that if we lose that right now it's less than 10% ICU capacity, then we're going to have to start looking for alternate ICU beds in either other counties or makeshift ICU beds. I know our hospitals have already sort of come up with their best ability to provide those additional beds.
I think she meant the increase in testing capabilities.
Oh, increase in testing. Well, that's okay. I apologize. Increase in testing capabilities, that is going to turn around as quickly as we possibly can. I mean, it's something that they're working on daily, and so I don't know how quickly they're going to be able to do it. As I mentioned, we're trying to get our lab equipment certified so that we can do the batch testing. And so I'm hopeful that within the next week, we're going to see the testing turnaround time increase. But I wish I could tell you it's a priority.
Another question, what is the county doing to support the youth in this pandemic? Since we know it affects youth in lower numbers, can we open some activities for them? Right now there are very limited activities, no parks, etc.
Well, and that's really why early on we allowed the social bubble of 12. This was not something the state encouraged. It was something that our health officers encouraged back in May to open up youth camps with 12 or fewer. And when you have 12 or fewer, that's sort of the concept of the social bubble, easy to track and trace if one person falls ill. And so we're really focusing on, we expanded as many outdoor activities as we could. We continue to find that outdoors, your transmission is far, far less. And so it's not just the county, because we don't even have a county Parks and Rec. I've got to applaud City of San Ramon because they really have come up with some wonderful youth camps. And if we continue to have schools closed for remote learning, right now the county is working with the state to talk about, can we continue though having these 12-person or fewer camps? Could it be a learning camp? Could you have a study group? Are there ways where even if we don't open schools that we can still have youth engaged in activities? But I've got to say some of the best activities, as a family, get out on East Bay Regional Park District trails, utilize the parks in our community. No, we're not. And the reason playgrounds are not open is that the state is not yet allowing us to open playgrounds. There is, I think, a concern less about the transmission on the equipment, although it's difficult to sanitize it quickly, more concern about parents and others gathering closer than 6 feet apart and children playing together closer than 6 feet apart when they're not part of a social bubble. But you've got to be creative. And I've seen a lot of creative groups coming up with ways. Churches are allowed to still meet outdoors, and you could certainly have you're not supposed to have youth separately meeting, so to speak, but you could certainly have, church activities outdoors, which would engage youth. So this is the time to be creative. Sometimes government does a really good job of things, but when it comes to outdoor activities, other than the great Parks and Rec program City of San Ramon and other cities provide, I think you've got to just use your ingenuity, come up with some great ideas.
All right, we have another question from Judy. Very appreciative of the work you are doing and your leadership in this time of great uncertainty. Is the county evaluating the antibody testing or the quicker testing methods yet, such as those offered by Abbott?
Yes, absolutely. And so with regard to antibody, we have been doing antibody testing in some parts of the county, not to see if someone's well or sick, but really to see how spread the virus has been. And right now our studies, and again, they aren't published yet, anecdotally, we're seeing in some of the harder hit communities out in West County, less than 3% are showing the antibodies. The trouble, of course, with antibody testing right now is we don't know what it means. And as you probably have read studies, they're showing that even people who have had very harsh cases of COVID, the antibody count drops fairly rapidly. And so we still don't know if you have antibodies, does it mean you won't get sick again? Does it mean you won't get as sick again? Or are you protected? And so that's one of the reasons we haven't pushed widespread antibody testing, because it won't, other than to just sort of track community spread. As far as rapid turnaround tests, we would love to see those come out quicker. Right now, the accuracy is not that great. And that's the biggest concern of our health officer. You know, it would be great if we had a saliva test where we could all spit into a little cup, hand it over, and we could determine whether or not we have COVID, you know, in a matter of seconds or minutes. The technology is not there and the accuracy is not there. And the last thing we want to do is give people a false confidence that they are not ill, if in fact they are. But we are looking at that, and I know particularly in a hospital setting, you know, a woman's in labor or someone's coming into the hospital where the hospital needs to figure out what sort of PPE do we need to have on. It's helpful to have those rapid turnaround, but one, they're not mass available, they're not FDA approved for what we'd love the purpose to be, and we still hope they'll be a little bit more accurate before we widely embrace them. But I agree, short of a vaccine, having that rapid turnaround testing is going to be just critical for moving forward.
We have another question from Sridhar. Could you please share more information regarding Iron Horse Trail improvements for 2 lanes and any ETAs on rolling out this project?
Okay, well, and I did not bring it up, and I certainly could have. We did just complete an Iron Horse corridor study. And so, as many of you know, because you've heard me talk about it for years, when the county purchased the Iron Horse Trail, when Southern Pacific abandoned the railroad, we bought it using certain grant monies that essentially said, you're going to buy this Iron Horse corridor and you're going to study and potentially put in a bus or light rail down the Iron Horse Trail. And so we studied it right after we purchased it. It really wasn't feasible at the time. It's been studied, in fact, as recent as 5 years ago. Dave Hudson on San Ramon's council and I sat on a committee, and we found that if we were to try to do something, and it wasn't just running straight on the trail, but below the trail, say BART running below the trail, you know, we were talking $4 to $6 billion. The reality is that no elected official and no community members wanted to see us rolling buses down the Iron Horse Trail. And I remember when I was appointed to Danville's Town Council in 2003, Millie Greenberg, who was on the council and had just become the county supervisor, when I asked her about it, she said, well, over my dead body. And that's sort of the reaction we've had from people. So we went to the state and we said, this is really being used as an active transportation corridor. We'd like to look at bicycle expressways. We'd like to look at ways to have trail separation. Can we get out from under this edict? And they essentially said, no, you need legislation. And so Assemblyman Tim Grayson did get some legislation passed last year that identified the benefit of it being an active transportation corridor, which means bikes, pedestrians, et cetera. And so we did do a study to look at the capacity. And so they broke the trail into different segments, and it was just a study. It wasn't a project. And so, for example, in San Ramon, you've got a lot of width. And so trail separation would be a good idea. And maybe you even have room for us to consider someday, you know, an autonomous single occupancy autonomous vehicle running from Bishop Ranch down to Dublin BART. You know, you have that capacity. That's a very controversial topic, as my friends in Alamo will tell you, because the fact that it even showed up as a possibility anywhere on the trail had them very, very much up in arms, because most people just value this trail as such an amazing amenity to walk, to ride. You are, with East Bay Regional Parks District, who manages it, allowed to use electric bicycles running at a low speed on the trail. And so much of this study looked at what trail improvements could be used so that more people might use it as a commute to commute to BART, to get to and from school. And so right now there are no projects pending, but we will be, through the Contra Costa Transportation Authority, through the county, we have a bicycle advisory committee, start looking for how can we bundle money to build such a project. And I will add, one of our bases, one of the impetus for us to move forward with the legislation to get us out from under that edict to someday run buses or light rails over it was in San Ramon, your Bollinger Canyon bicycle pedestrian bridge that is currently in its final design phases. You would have had to design it very differently if we were going to run trains over it versus just bicycles and pedestrians. And so we really wanted that issue resolved prior to you going into final design and actually building of that. Challenge 2 we have right now is that many of our road projects are funded by both sales tax and by gas tax, and both of those have declined significantly for obvious reasons. And so many of the projects we currently have funded are at risk. And so it'll be a few more years before we can really take on some of these bigger projects. But I look forward to working with San Ramon on the types of improvements or pilot projects they would like to see taking place on their segment of the Iron Horse Corridor.
All right, I think we have time for one more question here
Okay.
we got one from Patty Hoyt. Is there any interest in the Bay Area counties uniting their health orders again as they did in the beginning?
There is, and they still talk. And so we've had this discussion with Dr. Farnatano. And so they speak still several times a week. They talk about the benefit of having a consistent order. But there was sort of this desire and political pressure by their boards of supervisors, and particularly I think San Mateo County, to just open things up quicker. Our Board of Supervisors tends to be very respectful of the authority of Dr. Farnatano, and we really feel like we've kept a lot of our community safe. From day one, though, I have said, can you have an economist in the room too, just so we can see the benefit of the health order versus the impact on the community, because it has been such a profound impact. So to your question, Patty, I doubt we'll get back to a unified Bay Area order. I think the governor continues through his process of putting us all on his watch list, so to speak. He, in fact, has sort of de facto brought us back to a consistent Bay Area. San Mateo County just got added to the watch list yesterday. If they're on it for 2 more days, they are going to have to shut down a lot of their activities that none of the rest of the Bay Area is able to do because of those limitations. But yeah, there's great wisdom in having consistent health orders, because it doesn't help to have people pouring into an adjacent county, infecting those people just to get the services they can't get in their own county.
Thank you, Candace. We really appreciate your leadership. I believe Stu is going to come back up on stage.
Then I'm going to put on my mask.
Well, thank you so much, Supervisor Andersen. You've done an excellent job. As you can see, there's a lot that goes on in our county, and it's been a very difficult year for everybody. So thank you for attending. Thank you for participating, and please be safe and well. Thank you so much.